Paula McGowan believes her son's death could have been prevented. Oliver, who had autism, died in the UK in 2016 at age 18 after medics gave him an antipsychotic drug that he'd asked not to be prescribed. He'd previously suffered a bad reaction. This time, it killed him.
It caused his brain to swell so badly, it was bulging out the base of his skull. It dawned on me that the doctors and the nurses, they didn't understand autism.
Before moving to Australia in 2018, Miss McGowan launched a campaign to have medics receive mandatory autism training, an initiative the British government has backed. She and others are now pushing for a similar strategy here. The calls now have the backing of new research, which examined the causes of death of 36,000 people with autism.
We found that people on the autism spectrum died at a rate twice that of the general population. The presence of mental health conditions, complex physical health conditions, and the presence of epilepsy and nervous system disorders.
Almost 164,000 Australians have autism, and that figure is up 40% from 2012. While it shows we've gotten better at diagnosing the condition, experts say this latest study reveals a need to improve the way we treat it.
In 10 to 15 years' time, we're going to have a hell of a lot more adults diagnosed with autism than we do now. So if this is a problem that's this big at the moment, it's going to be enormous in 10 years' time.
Kathy Isaacs was diagnosed with autism in her 40s after discovering her son had the condition. She wants to see doctors treat people on the spectrum as they do patients facing a language barrier.
They need to know, first of all, to listen to us, how to listen, how to get information from a patient who's finding it difficult to explain.
Those on the front line are calling for a national strategy. So, as Miss McGowan puts it, no parent has to lose their child in the same way she did. Abby O'Brien, SBS World News.